You can type in any questions that you will have for Brett Blackburn. He's going to be talking about distributed online healthcare, right? There we go. So, does anyone know what distributed online healthcare is?
No, that's why we're here.
No? Okay, well, you're going to find out. See? Told you, Brett. All right, what that basically means, anyone here ever gone to a hospital or emergency care and had to fill out a whole bunch of forms, et cetera, et cetera? Well, imagine if it were appified and you were able to go in and get just the services you need, hassle-free, and have all your records distributed and delivered to the exact place you need it all at once, right? More or less. That would be kind of kick-ass, wouldn't it? That's what Brett's going to talk about. So he's a successful entrepreneur. He's built and sold multiple companies. He's smart. He's funny. So why don't we give a big round of applause to Brett Blackstone. He's going to talk to you about it. Take it away, man. Here's your clicker.
All right, thank you. Thank you very much. Again, my name is Brett Blackman, CEO and co-founder of a company
Blackman. Sorry about that.
You're good, bub. I'll take whatever. Right? All right, so CEO and co-founder of a company called Health Splash. So I'm going to start with a story. Then I'll tell you kind of why we're doing it, what we're doing, and how we're doing it. So in 2008, there was a group of dads. They were doing a study with their sons, kind of a way to transform from boys to men. It was called Raising a Modern Day Knight. And these dads decided that they wanted to take a trip to Mount Ida in Colorado. It's a 14,000-foot mountain. And they wanted to take this trip and hike with their boys. And so it's a 14-mile hike in one day. And you have to get to the top of the mountain by 2 p.m. It's a very difficult trek. So anyway, several weeks before they go on this trip, they decide to start working out. So they all work out. Good time for their dads and the sons to really bond and become men together, right? And so they start working out. They go on this trip. And one of the dads had 3 sons. He was the only one there with 3 sons. And on their way up the mountain, there was one of the dads with 3 sons, he started getting a headache, getting sick. He starts sucking on those oxygen tank bottles. If you start when you get up into high altitudes, you get some altitude sickness maybe. Starts vomiting. The sons are just razzing him. Like, oh my goodness, man, old man, you should have been working out with us a little bit more. We had this 70-year-old woman walking and just running right on past the whole group, and we're like, dude, Dad, you got to get on up the mountain. Carrying his backpack up the top of the mountain. We finally make it up to the top of this mountain, and we get to the top, and it was amazing. The dad sat down each son and told them what they were most proud about. Absolutely incredible time. They all go home, and a week later, one of the dads called his oldest son. And he says, Brett, that headache wasn't altitude sickness. I have brain tumor. He says, you need to come home. I was the oldest son. I was 24 at the time. My dad was 47. Immediately went home, sat down, my 2 brothers, 13 and 15, and we discussed what we were going to do with this new, what we called adventure. Our family motto is making memories, good, bad, the ugly ones, and everything. Immediately, I was pretty successful at the time, had a few hundred, almost 1,000 employees. I took 100 people in my company, and I devoted them strictly to research because I hate to freaking lose. And this wasn't a loss that I was willing to take. It was life and death for my dad. So I took 100 people, and we started doing research worldwide on what is the best solution for what this one was, which was a glioblastoma on the brainstem. Survival rate's 5%. But what they don't tell you when you're at MD Anderson Center is 5% means you live longer than a year. 100% are dead in 3. At that point in time, I realized how broken the healthcare system was. I was in digital tech, healthcare, EHR systems, all that stuff that runs all of our hospitals. That's what I was involved in. And I realized I had to do something, because what I realized at that moment was that there's Our society is so screwed up when it comes to managing data in the healthcare space. They continue to do it in all of these silos, and as a society, we're not working together. There are incurable diseases that are now being cured. 2 years ago, hepatitis was incurable, and now it is. 6 weeks, cured. But only one silo fixed that solution because we're not working together as an entire society. So my why on why I wanted to build what we're building is I wanted to be able to take and collect that information, that data, work together, and actually start finding cures of things that right now are incurable. They can absolutely be done. So I go to one of my friends of 10 years, a very, very successful businessman in Kansas City, is where I'm from. And I go to him, and he's one of the most brilliant engineers I've ever met. Owns a very successful technology firm. And I said, hey, I need you to help me build this. This is what my idea is. And he goes, you know what? My CTO, I was sharing him with my CTO, and he goes, Brett, my why's a little different. And he goes, my wife, who currently, she has, not my wife, but my CTO's, stage 4 breast cancer. And 6 years ago, when they found it, they found some cancer in one of her bones in her leg. And the doctor came in and said, we can go in and biopsy it, or I can just go in and remove it. Either way, I'm going to have to probably remove it if I biopsy it and find out that it is a cancer cell. So they opted to actually remove a portion of her leg. The surgery actually went really, really well. Got all of it. 6 years later, just last summer, they're working in the community garden with her son, her daughter, and his wife. And immediately she collapsed in screaming, agonizing pain. Jeff ran over, grabbed her by the arms, knew exactly what happened. Like, he immediately knew. He said, call 911. Calls 911. The ambulance comes out. They rush her to KU Med Center, which is one of the top surgical centers in Kansas City, because that's where the physician was practicing at the time, at that moment. They had done the surgery previously. And they get in, and they take an x-ray of the system, and literally, they're sitting there, and they're like, we can't even tell what the leg looked like before it got twisted and mangled and destroyed. So she's in agonizing pain. And we got to get the medical records from Menorah, which is a different hospital silo down the street, on a different system. And it's going to take 2 to 3 days to get that. And he's sitting there thinking in his head, my wife is in agonizing pain in a hospital bed, and it's going to take 3 days to get a picture. He goes, I have the picture on my cell phone. Will this work? That's the one I was just showing. And they immediately took him back into the consultation room with all these doctors, and they're looking at his cell phone, blowing it up on the screen to figure out if they could actually rebuild her leg with a new one. And they successfully were able to. And he goes, my why isn't the data, my why is the medical records. I want to make sure my family, my medical records are with me at the time I need them, to make sure they go to the right person at the right time so that I can at least eliminate my family's pain, suffering. So his why was making sure he controlled his own information. HealthSplash's why is to deliver the right data to the right person at the right time to save lives. And according to the CDC, just in the United States alone, over 900,000 people a year die from preventable diseases from not doing that. That's just in the United States, millions worldwide. My why was for my dad to see my son for the first time before he passed away. Jeff's why was to make sure that he managed his own family's care, because did he really want his wife going through that kind of pain? Maybe your why's transparency of the data system. I mean, people are like, Brett, you get pretty intense. And I'm like, I don't know of a good yeehaw solution in healthcare. Yay, I'm saved. By the way, here's your bill. You might go bankrupt, or by the way, sorry, we didn't save him. By the way, here's your bill. I don't even know what it cost. Millions? We don't know. It's like going to the grocery store, getting all your groceries and getting a bill a month later and having no idea what that's going to be. But it could bankrupt you if you're not careful. I know in transparency, plan of care is important. I won't go to and buy a TV without looking at reviews on Amazon. But yet, I'm supposed to go to a doctor who's supposed to save my life, and I have no idea other than maybe some other doctor referred him to me. Maybe it was a country club buddy. I don't know. My payer said to go there. I have no idea. To give you an example of this, my grandmother, after losing her son, and then a few months later lost her mother, had a heart arrhythmia. And so they put her on some medication. And our family thought that she just lost her joy. I mean, I couldn't imagine losing a son. I couldn't imagine losing my mother right afterwards. I mean, within months. And for 8 years, she was on this medication with this heart arrhythmia. We just found out in the last 7 months that the illness, the lack of strength, just the lack of joy, the depression, had nothing to actually do with what happened to her 8 years ago. 9 years ago now, when she lost her son. It had everything to do with the medication she was on. And the reason she was on that medication, that doctor, that was the only one he knew for that particular situation. Till she went to a different specialist and saw a different solution. And now she's fine. She lost 8 years of quality life during her 70s and now into her 80s that she can't get back. Because the plan of care was only what that doctor knew. Not what society knew, but what that doctor knew. And it's not the doctor's fault. It's too much information. My family, just lots of tragedy, right? My family, myself, men in my family died before the age of 60, most of us, and mainly of heart disease. And so I am building a solution on our platform specific to me, which is to manage and monitor biometric data. There is actually proven data technology solutions that can take biometric data, your wearables, combine it with your medical history, your genetic testing, and can actually predict if you're going to have a heart attack up to 2 months in advance. Did anybody know that? It's there, waiting to be used, and no one's using it. That's one of the projects I'm personally working on. So our question is, if healthcare is broken, it is absolutely time to own your cure. And that's exactly what we do.